Welcome to the Cardiovascular and Diabetes Risk Use Case. This is a story of Francine, who is a 65-year-old female with a history of cardiovascular disease, diabetes, and other comorbidities associated with the disease. During this use case, we're going to demonstrate how interoperability plays a central role in Francine's care, how Epic, the EMR system, drives and records many aspects of the workflow, how Omnicell, the inventory management system, manages drug access par levels across the customer's healthcare system, how GUARD RFID location system helps locate devices and their current status, as well as the location of patients, and how the B-Bron smart pumps are auto-programmed by Epic and then send real-time infusion data back into the medical record, how Spoke handles the alarms for many devices and routes them to the appropriate nurse, and then how Philips, the spot check monitor, monitors the patient vital signs and assigns an early warning score. So on this day, Francine is enjoying the day with her family when she becomes increasingly short of breath and lightheaded. Because of her family history, they decide to bring her to the emergency room. I'm the nurse taking care of Francine today, and when she arrives to the ED, I immediately place her on the Philips spot check monitor. The Philips monitoring system assigns an early warning score, which helps aid me in Francine's condition. I can admit Francine from the monitor, and as you can see on the monitor now, her vital signs are borderline. However, the protocol does recommend that I monitor with a Philips wearable sensor. I can find the Philips sensor with the help of the GUARD RFID tag, which helps track the equipment. And we can also tag Francine at this time for the times that she's not attached to any equipment. Right now I'm going to have Peter from Philips explain the early warning score and the wearable sensor to you.
So this is the Philips spot check monitor, and we configured here a MUSE protocol, a modified early warning score protocol that can be adjusted to the hospital or national requirements. Most of the input parameters are measured by the monitor, like blood pressure, SpO2, pulse, but also parameters can be inputted by the nurse, for example, respiration rate, or we have to hear this assessment of her level of consciousness, so you see he's still alerted. Then all the input parameters have a subscore, and the subscore contributes now to the overall score, which can be seen in the upper left corner right now. Each score is assigned to a wristband. In this case, we have an observe wristband. And for each wristband, you can define the next steps for a nurse, a recommendation. In this case, the recommendation is that the nurse should put a wireless sensor here. We have here an SpO2 sensor that measures SpO2 and pulse rate to the patient. The data from the sensor will be uploaded to the Philips Guardian system. I press here the store button, and also the spot check record is now uploaded to the Guardian system. From the Guardian system, the data are sent to the EMR using an IHE profile. In the background, all the data from the sensor are analyzed by the Guardian system for any patient deterioration.
Thank you. So in this instance, the doctor also ordered a normal saline infusion, but instead of auto-programming at this point, I manually programmed the pump. But it is also important to know that even with interoperability, the nurse never loses the ability to set up and run an infusion manually. But we can also associate that pump at a later date, so the information will flow back into Epic at that time. So at this point, we got Francine stable in the ED, and now we're going to transfer her to an IMCU bed. And after some time in the IMCU, there's a deterioration in Francine's condition. This is picked up by the Philips Guardian system, which then sends an alarm to the Spoke manager and then back to my cell phone. So we're going to have Spoke explain that process to you.
Okay, so as soon as an alarm goes off on the Philips monitor, we're going to have a standard HL7 message be delivered directly to Spoke. That message is going to come across immediately and include a series of information pieces that we need to pick up. We're going to look at the event, qualify it as an event that needs to be processed, and we're going to automatically disseminate that out to the primary caregivers that are assigned to Francine's care. So as we can see over here on the Epic monitor, the alarm has popped up So if Lori is at the station, she can immediately interact with that notification to be able to accept the message and be able to proceed to the patient's bedside. Should Lori not be at the station, she can receive a notification on her mobile phone as well, which will allow her to address it. Now, Lori may be with another patient. She may not be ready to take care of Francine, and she needs to know whether or not she's going to be interrupted from this other patient to make sure that she doesn't interrupt them to proceed to the bedside. If this is an important notification, we can provide a notification out to the phone that's going to give a unique ringtone. That's going to tell Lori that this is an important notification that she needs to take care of, and she can address it. So she's going to receive a notification on the device, she can accept that, and then proceed to the patient's bedside. Should this be a lesser notification, or if she's too busy to be able to manage this, she can choose to escalate this event from her device, automatically delivering it to the next person in line on the care team to ensure that Francine is taken care of properly. Should Lori not be able to respond to the event, then an automated escalation will occur, ensuring that Francine gets care.
So as the nurse, I assess Francine and her early warning score and then contact the doctor. The doctor at this time has made a clinical decision to start her on a nitroglycerin drip. After looking at her vital signs, her blood pressure continues to escalate. So we're going to auto-program the nitroglycerin drip with the help of Epic. But first, the doctor will place the medication order into the Epic CPOE, which is then sent to the pharmacy for verification. While the pharmacy is processing the IV order, I also noticed that there are no available pumps. So Guard RFID is going to help us locate one.
Thank you. As Lori said earlier, when Francine was admitted to the emergency room, she was given a tag like this, which was placed on her wrist for the purpose that we can find her when we need to locate where she is. How that works can be seen here on this screen. You can see here on screen the showcase floor plan. We are currently in this vignette here. And there are a number of people here in a showcase, and they are mainly showcase employees who carry similar tag as Francine was given. And you can see as these blue dots move around the screen to where each one of those people is. Similarly, what we do for patients, we do also for equipment. So what you'll see on screen is equipment for about 4 or 5 different vendors here within a showcase, and they are in different vignettes where their equipment is. And location of their equipment is shown in Guard RFID system. When we receive information about location of the equipment, we send back that location information to each of those vendors, so they can put location of their equipment into their own applications. This information sharing is possible because we exchange data over HL7 and following IHE profiles. You can see how some of these pumps and equipment in general is shown in yellow, some of them in green. If we open up details about 2 of these pumps, one which is yellow and one which is green, you will see that green pump is currently showing as not infusing, meaning that it's potentially available for the new patient, while the yellow pump is showing that it is infusing. It also shows which medicine is being infused. It shows what kind of power supply it is connected to. Is it main power supply or it's battery? So let's now try to find out available pump that we can use for Francine. And we're going to pick one of those that is shown in green. And that is Biberon pump. And you can see here that it is shown to be where the Lori just found it, and now she's going to put it to use.
Okay, thank you. So now I have the pump, I need the medication. But unfortunately, there is a shortage of this medication in the hospital. So Omnicell is going to help us manage our inventory.
So with the threat of medication shortages, it's important that a health system know where the medications are throughout the health system. Omnicell's enterprise medication management system uses standard HL7 messages to find inventory across the health system that's being managed and brings it together in one portal. So the pharmacy is able to quickly do a medication search for the medication. In this case, it's nitroglycerin. See where it's located. And here we find the vial that we need to prep our bag. We can see where it's located throughout the health system, what medications that they have, and not only that, we can transfer it to the pharmacy so we can prepare the medication. So here I'll transfer one vial over to our facility, and then we'll prep that bag.
So now I have the medication and I have the pump. So we're going to auto-program this medication with the help of Epic.
All right, so earlier we talked about how we programmed the pump manually. That's because we didn't yet have an order placed in the Epic system. Now that we have some time to place that order and we've found the pump and the medication, we can use barcode scanning to get those details to the pump electronically using HL7 version 2 messages. So since I already have the patient's chart up, I don't need to scan the patient's wristband. I would first start with the medication and then the pump. This brings the details up on the screen that I can verify those order details and then send them on to Bebron.
So if you watch the screen from the landing page, you'll see that the order is received. So the nurse will press OK to accept the incoming order. She'll have to enter the care unit by pressing OK because you still want those hard and soft limits applied appropriately. And then check the values, because even though those values are sent over to the pump, the nurse has a critical role in ensuring that that information is correct. She can then press OK and then start the infusion. Once the infusion is started, that information will flow back into the medical record. So now that I have both the nitro and the normal saline infusing, Francine happened to roll over and kink her IV. So just as before, the pump will send the message to a spoke alarm system, which will then send an alert to my cell phone so I can address the alarm. You'll also be able to see in the dose track Bebron software in real time that alarm occurring. So if the nurse happens to be at the station, she'll know what the alarm is happening without going to the room. So right now it's in an alarm state and it's showing that it's a downstream occlusion. So once I address the alarm and restart the infusion, again, you'll see that the infusion is restarted in the dose track system. So Francine has been stable and in the step-down unit for the past 8 hours now, and Epic has captured that 8-hour time frame, and we're going to talk to you about that.
So here we've talked about getting data both from Philips and from the infusion pump, and getting those back through HL7 messages into the EMR. On the screen, you can see that data trended over time, so you can see if the medications that we were giving were effective. When Francine first presented at the ED, she was still relatively stable, had that low early warning score. At around 1500, we see her BP spike. That's when we got that higher early warning score from Philips at above a 5 and decided to start the medication. Below, you can see when that medication was started and was infused over time, and see her vital signs come back down to normal.
Thank you. So with this use case, we highlighted how we were able to provide care for a patient like Francine while still leveraging interoperability with a variety of different vendors that you see here. We showed you patient vital sign and monitoring with the early warning score from Philips, which quickly identified signs of Francine's deterioration and prevented an adverse event. We showed you medication management from Omnicell and how that can help us with our PAR levels and shortages, and we found the drug we needed for Francine in a timely manner. We also showed you auto programming with the B-Braun smart pump and then auto documentation back into Epic, eliminating potential error that may occur with manual programming. We showed you the location system integration with Guard RFID. So Guard helped me track my devices, and I was able to find the equipment when I needed it. And then we showed you alarm management and routing to my cell phone with Spoke, which allowed me to quickly respond to Francine's condition. And finally, we showed you how all that information flows back into the medical record with Epic, allowing us to provide efficient, safe care for Francine. So thank you. That's the end of our use case. If you have any questions, please stay and we'd be happy to answer them for you. If not, we'd be happy to answer your questions at our booths. Thank you.